Welcome. In this video, we'll be discussing primary cholangitis, or PSC. PSC is a chronic liver disease that slowly damages the bile ducts inside and outside the liver. We'll explore what causes PSC, how it affects the body, its symptoms, diagnosis, treatment options, and more. Let's dive. The exact cause of PSC is unknown. It's believed to be an autoimmune disease where the body's immune system mistakenly attacks the bile ducts. Genetic factors likely play a role, as PSC is more common in people with a family history of the condition. A strong association exists between PSC and inflammatory bowel disease, particularly ulcerative colitis. However, the link between these two conditions remains unclear. PSC is characterized by inflammation and scarring, or fibrosis, of the bile ducts. This inflammation leads to narrowing and blockages of the ducts, hindering the flow of bile from the liver. Bile, a fluid that helps with digestion, backs up into the liver, causing further damage. Over time, the chronic inflammation and scarring can lead to cirrhosis, liver failure, and an increased risk of bile duct cancer, also known as cholangiocarcinoma. PSC is a relatively rare disease. It affects men more often than women. The average age of diagnosis is around 40 years old, but it can occur at any age. As mentioned earlier, a significant portion of individuals with PSC also have inflammatory bowel disease, with ulcerative colitis being the most common association. It is estimated that between 2.4 and 7.5 people per 100,000 will be affected by PSC. The symptoms of PSC can vary widely from person to person. Some individuals may not experience any symptoms, especially in the early stages. As the disease progresses, common symptoms include fatigue, itching, jaundice, which is yellowing of the skin and eyes, abdominal pain, and fever. Some may experience weight loss, night sweats, or enlarged liver and spleen. Complications like cholangitis or bile duct infection can also cause fever, chills, and severe abdominal pain. Diagnosing PSC typically involves a combination of blood tests and imaging techniques. Liver function tests can reveal elevated levels of liver enzymes, indicating liver damage. Imaging tests, such as magnetic resonance cholangiopancreatography, or MRCP, can visualize the bile ducts and detect any narrowing or blockages. A liver biopsy may also be performed to assess the extent of liver damage and rule out other liver diseases. While there aren't distinct classifications of PSC in the traditional sense, the disease is often staged based on the extent of liver damage and the presence of complications. The Mayo Risk Score is a commonly used staging system. This score incorporates factors like bilirubin levels, albumin levels, prothrombin time, and presence of edema to estimate survival probability. Staging helps in determining the severity of the disease and guiding treatment decisions. Currently, there's no cure for PSC. Treatment focuses on managing symptoms, slowing the progression of the disease, and preventing complications. Ursodeoxycholic acid, or UDEG, is a medication often prescribed to help improve bile flow and potentially slow down liver damage. However, its effectiveness is still debated. Medications can also be used to relieve itching. Cholangitis, or bile duct infections, are treated with antibiotics. For narrowed bile ducts, endoscopic procedures like balloon dilation or stent placement can help improve bile flow. Ultimately, for advanced cases of PSC leading to liver failure, a liver transplant is the only definitive treatment option. Because the exact cause of PSC is unknown, there's no proven way to prevent it. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding excessive alcohol consumption, can help support overall liver health. For individuals with inflammatory bowel disease, proper management of their condition may potentially reduce the risk of developing PSC, although this is not definitively proven. The prognosis for PSC varies greatly depending on the individual and the stage of the disease at diagnosis. Some people may live for many years with minimal symptoms, while others may experience rapid progression to liver failure. Complications like cholangiocarcinoma significantly impact the prognosis. Liver transplantation offers the best chance for long-term survival in individuals with advanced PSC. Research is ongoing to better understand the cause of PSC, identify new treatment targets, and improve long-term outcomes. Recent studies are exploring the role of the gut microbiome in the development and progression of PSC, as well as the potential of novel therapies targeting the immune system and liver fibrosis. Clinical trials are essential to advancing our knowledge and finding better treatments for this challenging condition.